Hi, hello, welcome back. Let's discuss another interesting neuroradiology case. So the patient presented with tinnitus, and these are the findings. So what is this condition? It's a spotter in the short case. So this is a classical brain herniation into arachnoid granulations, which is also called BAG. So arachnoid granulations, these are the small protrusions of arachnoid membranes which project into the venous sinuses. And these cause a lot of confusion, can be confused with some chronic thrombus sitting in a venous sinus and all. You should be knowing this condition as a normal variant. Arachnoid granulations can mimic a chronic thrombosis. Okay, you should never confuse arachnoid granulations. They indent the sinus rather than just filling the sinus. So this is very important. They are located mostly in the posterior fossa region, especially in the occipital. So it is always mention such findings in your report. The problem comes when there is some brain parenchyma protruding into it. Brain herniation is a condition, tissue displaced from normal position protrudes into openings of the skull. So when there is raised ICP, definitely a brain tissue can find a path to just go into some of the surrounding areas. So similarly, increased pressure can cause the arachnoid granulations to become compressed or blocked, leading to accumulation of CSF or brain. Symptoms of brain herniation into arachnoid granulation can be asymptomatic. However, you can see nausea, vomiting, confusion, seizures, and loss of consciousness. One of the interesting finding recently they have been documenting is vertigo or tinnitus. Tinnitus can be a classical finding in this condition of BAG. So brain herniation into arachnoid granulation is one condition which has been recently circulating in our neuroradiology journals, and I thought you should all know about this condition. So this is again a case where there is a pulsatile tinnitus, and the patient also had idiopathic hypertension. So this is a summary of this article. So you can go through and read from the diagnostic radiology. The study identified that locations of BAG in typical locations, especially near the transverse sigmoid and superior sagittal sinuses. And if there is documented seizure foci, if there is no other documented seizure foci, and if you identify and localize it to BAG, then it may require a surgical intervention. And sometimes there was also associated discussion about IIH, and they would discuss that to prevent IIH, how should we go about it. Thank you very much. Hope this video on BAG was useful for you.